The mental health system doesn't sort of sit in its office waiting for the individual to come in to keep their appointment and get their medication refills, get their medications checked, get other type of therapy. We actually have multidisciplinary teams, including consumers, patients, people who are peer support. Go out and meet that individual on their terms and engage them in treatment and get them to come into the treatment system. Assertive community treatment is very successful. There's enormous evidence backing it up. And those are the types of state-of-the-art services we believe that communities should be investing in to prevent that downward cycle into chronic homelessness.
What is the pattern? I know that a number of people will come to Texas because it's not as cold as the East Coast, especially if they don't have shelter. Is that tracked to see whether or not some illness is just more noticeable or more present in certain locations in the country, or are there other factors considered?
Well, there's some data out there demonstrating that chronic homelessness concentrates, at least is more visible in large cities because of the existence not so much of good programs, but largely shelter systems that are very accessible. And when I say accessible, meaning communities that have made a commitment to we will not have unsheltered individuals on our streets. So having shelters that are easy to enter without any barriers or entry in terms of qualifying for a program will tend to concentrate chronically homeless individuals in downtown areas. And now no one's arguing to take away those services, but what we need, quite frankly, is a backdoor out of that shelter into permanent supported housing. Because shelters work for some individuals, but there has to be a way out of that shelter system into permanent housing, where essentially all you're doing is
housing.
All you're doing is really quite frankly, it's the old the movie where the guy built the baseball field in the field of dreams.
Yes.
If you build it, they will come. We need to have a good shelter system, but we also need a backdoor out of that shelter into permanent housing, or you're just essentially institutionalizing and warehousing homeless individuals in a shelter system that's already overburdened.
Well, what is the percentage of people dealing with mental illness in the U.S.? Are we keeping any statistics?
Yeah, we have prevalence data that's compiled by the government, by the National Institutes of Health and an agency called the Substance Abuse and Mental Health Services Administration. And for severe mental illness, the prevalence is about a little over 2 million Americans with schizophrenia, bipolar disorder. If you add in depression and anxiety disorders, it branches out to about 8.5 to 9 million Americans. So this is a fairly large population we're talking about.
If families think they notice a pattern or notice a change in behavior, is there a way they can access a helpline?
NAMI has a helpline. It's 800-950-NAMI. There's others that are offered by the National Institute of Mental Health, Substance Abuse and Mental Health Services Administration. There's suicide prevention hotlines. All of these are ways to enter the system, and there's also other tools. Quite frankly, getting professional medical help, and not only through many access it through the primary care system, but also the specialty mental health care system where individuals eventually get referred to.
Is that happening more and more, or is it lagging?
It really varies across the country, quite frankly, in terms of the portal by which people enter the public mental health system. In some cases, in order to qualify for these types of services, you've got to sort of fall down and reach a level of impairment before you can qualify for certain programs. And some of these are at the federal level, for example, to actually qualify for disability benefits under supplemental security income or Social Security disability insurance requires you to be impaired so severely that you can't work at any job in the American economy. Other types of programs and services are available a little easier. But we're working at trying to alleviate this so that you don't have to essentially reach the severe end of the spectrum before the system will help you.
How is this impacting teens or younger people, either young people who have witnessed some of the mental, emotional illnesses within the family, or sometimes the family does not have any example of someone who needs mental health care where there might be teens affected?
What we do know is we don't know a gene yet that causes these disorders, but we know that there's genetic predisposition, that you have certain genes, you're vulnerable to get an illness such as depression or bipolar disorder or schizophrenia. But we also know that there are certain things that can trigger environmental factors, and obviously living in a family under enormous stress where you have family dissolution, you have a parent who's living with one of these disorders, the child is going to be at risk of eventually getting it. So the idea there is to really intervene early. And what we know is there's also a lag between when an individual first exhibits the symptoms and when they finally get a diagnosis. It can really, which is a critical step toward getting help. And we're trying to narrow that window so we don't have someone essentially waiting 5 years to get that diagnosis. And not that they're waiting, it's more sometimes they can get different diagnoses before they get the right one. And we want to shorten that lag, because the quicker we get an accurate diagnosis and the quicker we get treatment, the less likely it is that they're going to fall down to the point where they're not able to work, they're not able to compete in school, complete their education. And that's really a critical step there. If they can complete their education, their high school, junior college, even college, without having the illness devastate them, their prospects for long-term recovery and productivity are much, much higher.
How would you advise a family to perhaps observe or notice some change in behavior in some member of that family, and how would you advise them to go about getting attention?
Get help quickly when you notice a child's, it's not just grade slipping, but you notice a disruption in their normal behavior, sleep patterns, diet, lack of motivation, not being able to get out of bed. I mean, those are obviously telltale signs of depression. Get professional help as quickly as possible. Reach out to groups such as NAMI and Mental Health America. Get them the services they need as quickly as possible. Get that diagnosis wherever possible.
Well, how would a family cope with this without feeling that they're going to be stigmatized?
That is a very difficult issue because parents feel, you know, to get that child the help is actually going to stigmatize that child and perhaps, you know, disrupt their peer support, their relationships with their peers. That is a very difficult issue. I think the critical thing is getting them the support they need to get back up to that level where they can complete their education and move on in their life and not have the illness really destroy their prospects for long-term education and success.
Well, we're about out of time, but I think there are families who are very, very concerned about privacy. Are we still attempting to be as private as possible when we have some?
Absolutely. And there are standards under a law Congress passed called HIPAA to ensure that medical providers keep information confidential, the electronic medical records that I know you work very, very hard on here in the Congress. We've got privacy protections in there to make sure that medical records are kept private. So it really that should not be a deterrent for families because treatment can be confidential and the records and the interactions with clinicians are covered by these laws that ensure privacy.
Well, thank you so much for taking time out of your schedule to come. I hope that we will begin to see a bit more activity in this area that we can address very early.
Thank you.
See you next week.
This has been another edition of Report from Washington featuring Congresswoman Eddie Bernice Johnson. You can reach Congresswoman Johnson at 202-225-8885 or 214-922-8885. You can also contact her through her website at http://www.house.gov/ebjohnson.